What is hypothyroidism? Imagine your body has a tiny thermostat called the thyroid gland, located in your neck. This gland produces hormones, T4 and T3, that act like a gas pedal for your body's energy and metabolism. Hypothyroidism is like having a faulty thermostat. It's underactive and doesn't produce enough of these important hormones. This slows down many of your body's processes. Think of it like running your car with the handbrake slightly on. Everything feels sluggish. Etiology or causes. Why does it happen? Several things can cause hypothyroidism. The most common reasons include Hashimoto's thyroiditis and autoimmune disease. This is the most frequent culprit in developed countries. Your immune system, which normally protects you from germs, mistakenly attacks your thyroid gland. Over time, this damages the gland and it can't produce enough hormones. Iodine deficiency. Iodine is essential for making thyroid hormones. If you don't get enough iodine in your diet, found in iodized salt, seafood, and some dairy products, your thyroid can't function properly. This is less common in countries where iodized salt is widely used. Thyroid surgery. If you've had your thyroid gland partially or completely removed due to conditions like thyroid cancer or goiter, enlarged thyroid, you'll likely develop hypothyroidism. Radiation therapy. Radiation treatments to the head or neck, often for cancer, can damage the thyroid gland. Medications. Certain medications, such as amiodarone, a heart medication, lithium, used for bipolar disorder, and interferon alpha, used to treat certain infections and cancers, can interfere with thyroid hormone production. Congenital hypothyroidism. Some babies are born with an underactive thyroid. This is usually detected through newborn screening tests. Pituitary gland problems. Secondary hypothyroidism. The pituitary gland in your brain tells your thyroid what to do. If the pituitary isn't working correctly, example due to a tumor, it can't signal the thyroid, leading to hypothyroidism. This is less common than Hashimoto's or iodine deficiency. Pregnancy. Sometimes pregnancy can trigger hypothyroidism, especially if a woman has pre-existing autoimmune issues. Pathology. What happens in the body? When the thyroid gland doesn't produce enough T4 and T3, it affects nearly every system in your body. This includes slowing of metabolism. This leads to weight gain, fatigue, and feeling cold. Brain function. Cognitive functions like memory, concentration, and mood can be affected. Heart rate and blood pressure can lead to a slower heart rate and, in some cases, high cholesterol. Digestive system can cause constipation. Skin and hair. Skin can become dry and hair can become brittle. Symptoms and signs. How does it feel? The symptoms of hypothyroidism can be subtle and develop slowly over time. They can also be easily mistaken for other conditions. Common symptoms include fatigue, feeling tired and sluggish all the time. Weight gain, unexplained weight gain, even without changes in diet or exercise. Feeling cold, being unusually sensitive to cold temperatures, even when others feel comfortable. Constipation, difficulty passing stool. Dry skin, skin feels rough, dry, and itchy. Brittle nails and hair loss, nails that break easily and hair that thins or falls out. Muscle weakness and aches, muscle cramps, stiffness, and pain. Joint pain, aches and stiffness in the joints. Depression, feeling sad, hopeless, or losing interest in activities. Memory problems, difficulty concentrating or remembering things. Goiter, an enlarged thyroid gland, visible swelling in the neck. Not always present. Hoarse voice, your voice may sound deeper or raspy. Menstrual changes, in women, periods may become heavier, longer, or irregular. Slowed heart rate, a slower than normal pulse rate. Diagnosis, how is it found? Diagnosis usually involves physical exam. Your doctor will examine your neck for a goiter and check your reflexes and heart rate. Blood tests. TSH, thyroid stimulating hormone. This is the most important test. TSH is produced by the pituitary gland. If your thyroid is underactive, your pituitary will produce more TSH to try to stimulate the thyroid. A high TSH level usually indicates hypothyroidism. T4, thyroxine. This is the main hormone produced by the thyroid. Low T4 levels confirm hypothyroidism. T3, triiodothyronine T3 is another thyroid hormone. It may be checked in some cases, but T4 and TSH are usually sufficient. Thyroid antibodies, tests for antibodies, e.g., anti-TPO antibodies, can help determine if Hashimoto's thyroiditis is the cause. Management and treatment. The main treatment for hypothyroidism is thyroid hormone replacement therapy. Levothyroxine and Synthroid, Levoxyl, others. This is a synthetic form of T4. It's taken as a daily pill. Your doctor will determine the correct dosage based on your TSH levels and symptoms. Regular monitoring. You'll need regular blood tests, usually every 6 to 12 months, or more frequently when starting or adjusting the dosage, to ensure your TSH and T4 levels are within the target range. Combination T4 and T3 therapy. Some people do not feel well on T4 alone. In those cases, a combination of T4 and T3, liothyronine, can be used, but should be done only under the guidance of a knowledgeable doctor. Self-care tips. While medication is essential, there are things you can do to support your thyroid health and overall well-being. Take medication as prescribed. It's crucial to take your levothyroxine every day, at the same time, and on an empty stomach, usually 30 to 60 minutes before breakfast, for optimal absorption. Also avoid taking it with iron and calcium supplements, which reduce its absorption. Diet. Iodine. If you live in an area where iodine deficiency is a concern, use iodized salt. However, don't overdo it, as excessive iodine can sometimes worsen autoimmune thyroid conditions. Selenium. Selenium is important for thyroid hormone production. Good sources include Brazil nuts, tuna, and eggs. Avoid goitrogens in excess. Goitrogens are substances that can interfere with thyroid hormone production. They are found in cruciferous vegetables like broccoli, cauliflower, cabbage, and Brussels sprouts. Cooking these vegetables can reduce their goitrogenic effect. Unless you're eating very large amounts of these raw vegetables, they are unlikely to cause significant problems. Manage stress. Chronic stress can impact thyroid function. Practice stress-reducing techniques like yoga, meditation, deep breathing exercises, or spending time in nature. Regular exercise. Exercise can help boost energy levels, improve mood, and promote overall health. Get enough sleep. Aim for 7 to 9 hours of quality sleep per night. Monitor symptoms. Keep track of how you're feeling and report any changes to your doctor. Supplements. Speak to your doctor before starting any supplements, as some can interfere with the thyroid. Important notes. Don't self-treat. It's essential to see a doctor for diagnosis and treatment of hypothyroidism. Don't rely on anecdotal information or unproven remedies. Be patient. It may take several weeks or months to find the right dosage of medication and for your symptoms to improve. Lifelong management. Hypothyroidism is usually a lifelong condition that requires ongoing management. Complications of untreated hypothyroidism. Untreated hypothyroidism can lead to serious health problems, including heart problems, infertility, and, in severe cases, myxedema coma, a life-threatening condition. Hypothyroidism is a common condition that can significantly impact your quality of life. However, with proper diagnosis, treatment, and self-care, you can effectively manage your condition and live a healthy and fulfilling life. Always consult with your doctor for personalized advice and treatment.